pn18. Q. The nurse is making initial rounds on a client with a C5 fracture and Crutchfield tongs. Which equipment should be kept at the bedside? A pair of forceps. B. A torque wrench. C. A pair of wire cutters. D. A screwdriver. Rationale. A torque wrench is kept at the bedside to tighten and loosen the screws of Crutchfield tongs. This wrench controls the amount of pressure that is placed on the screws. A pair of forceps, wire cutters, and a screwdriver, in answers A, C, and D, would not be used and, thus, are incorrect. Q. The nurse is caring for an infant who is on strict intake and output. The used diaper weighs 90.5 grams. The diaper's dry weight was 62 grams. The infant's urine output was A. 10 megaliter, B. 28.5 megaliters, C. 10 grams, D. 152.5 grams. Rationale. To obtain the urine output, the weight of the dry diaper 62 grams, is subtracted from the weight of the used diaper 95 grams, for a urine output of 28.5 grams, or 28.5 megaliters. 1 gram equals 1 megaliter. Answer A is an inaccurate amount, therefore, it is incorrect. Output is measured in milliliters, not grams. Therefore, answers C and D are incorrect. Q. The nurse is caring for a newborn with hypospadias. Which statement describes hypospadias? A. The urinary meatus is located on the underside of the penis rather than the tip. B. The ureters allow a reflux of urine into the kidneys. Cyrillic letter S. The urinary meatus is located on the top side of the penis rather than the tip. D. The bladder lies outside the abdominal cavity. Rationale. Hypospadias results when the urinary meatus is located on the underside of the penis rather than the tip. Answer B is incorrect because it refers to ureteral reflux. Answer C is incorrect because it refers to epispadias. Answer D is incorrect because it refers to exstrophy of the bladder. Q. The nurse is teaching a group of prenatal clients about the effects of cigarette smoke on fetal development. Which characteristic is associated with babies born to mothers who smoked during pregnancy? A. Low birth weight. B. Large for gestational age. C. Preterm birth, but appropriate size for gestation. D. Growth retardation in weight and length. Rationale. Infants of mothers who smoke are often of low birth weight. Answer B is incorrect because an infant who is large for gestational age is associated with diabetic mothers. Preterm births are associated with smoking but not with 130 Chapter 2 appropriate size for gestation, so answer C is incorrect. Growth retardation is associated with smoking, but this does not affect the infant length, making answer D incorrect. Q. While reviewing the client's lab report, the nurse notes that the client has a potassium level of 3.0 mcl. What is the best source of potassium? A. 1 cup of apple juice. B. 1 cup of orange juice. C. 1 cup of cranberry juice. D. 1 cup of prune juice. Rationale. 1 cup of prune juice provides 707 milligrams of potassium. Answers A, B, and C are incorrect because they provide less potassium than prune juice. 1 cup of apple juice provides 295 milligrams of potassium, 1 cup of orange juice provides 496 milligrams of potassium, and 1 cup of cranberry juice provides 152 milligrams of potassium. QA10, year-old has an order for Demerol meperidine, 35 mg for pain. The medication is available as Demerol 50 mg per ml. How much should the nurse administer? A. 5 megaliter. B. 6 megaliters. C. 7 megaliters. D. 8 megaliters. Rationale. The nurse should administer 0.07 ml of the medication. Answers A, B, and D are incorrect because the dosage is incorrect. Q. The nurse should observe for side effects associated with the use of bronchodilators. A common side effect of bronchodilators is A. Tinnitus. B. Nausea. C. Ataxia. D. Hypotension. Rationale. A side effect of bronchodilators is nausea. Answers A and C are not associated with bronchodilators, therefore, they are incorrect. Answer D is incorrect because hypotension is a sign of toxicity, not a side effect. Practice exam 3 and rationales 193. Q. The physician has prescribed Brantidine, Zantac, for a client with erosive gastritis. The nurse should administer the medication 30 minutes before meals. B. With each meal. C. In a single dose at bedtime. D. 60 minutes after meals. Rationale. Zantac, Brantidine, is a histamine blocker. This drug should be given with meals, for optimal effect. It should not be given before meals, so answer A is incorrect. Tagamet, cimetidine, is a histamine blocker that can be given in one dose at bedtime, so answer C is incorrect. These drugs should not be given after meals, so answer D is incorrect. Q. Select the nursing theorist who is accurately paired with the theory or model of nursing that they are credited with. A. The 12 nursing problems Faglen Abdellah. B. The nature of nursing Imogen King. C. The goal attainment theory Virginia Henderson. D. The interpersonal relations model Hildegard Peplow. Rationale. Hildegard Peplow is credited with the interpersonal relations model. Faglen Abdellah developed the 21 nursing problems. Imogen King is credited with the goal attainment theory, and Virginia Henderson is credited with the nature of nursing theory. Q. Who should document care? A. The LPNs should document the care that they provided and the care that was given by unlicensed assistive staff. B. The registered nurse must document all of the care that is provided by the nursing assistants because they are accountable for all care. C. All staff members should document all of the care that they have provided. All staff should document all of the care that they have provided, but the registered nurse, as the only independent practitioner, signs it. Rationale. All staff members, including unlicensed assistive staff like nursing assistants, document and sign all of the care that they have personally provided. For example, the nursing assistants will document the vital signs that they have taken. The licensed practical nurses will document all of the treatments and medications that they have given to the patient. And the registered nurse will document nursing diagnoses and assessments that they have completed.